It's my pleasure to welcome May Abdul Wahab, Director of the Division of Human Health at the International Atomic Energy Agency, and Nelly Enweren-Bromson, Director of the Programme of Action for Cancer Therapy, also at the IAEA, to discuss how UN agencies and other key partners can answer to the call to action put forward by the Global Task Force on Radiotherapy for Cancer Control. First of all, May and Nelly, thank you very much for joining us. And to start off with, Nelly, we'd be really interested to hear more about what role you think UN agencies can play in responding to the call to action and for helping to address the global gap in radiotherapy access.
Global efforts to address the growing demands for comprehensive cancer control, particularly in low and middle income countries, have been insufficient. Development agencies, among which the UN system, relevant multilateral and regional financial institutions, as well as global partners supporting health systems, must align their agendas and financing mechanisms behind national priorities to ensure that cancer control interventions are effectively and sustainably financed, and that limited domestic and international funding is significantly increased. And this is where UN agencies are well placed to exercise leadership in mobilizing key stakeholders and in establishing sustainable partnerships to support our member states to address the common goal of improving access to cancer care. WHO plays an important role as the UN agency responsible for health. It provides key leadership and advice on the evidence base for international action on prevention and control of NCDs, including cancer. And together with the IAEA, it has a crucial role to play in calling for the inclusion of radiotherapy coverage in universal health coverage plans to prevent catastrophic out-of-pocket expenses, particularly in low and middle-income countries. The IAEA in particular has a long history in supporting countries in their fight against cancer. As a specialized UN agency, we focus efforts on strengthening capacities for radiation medicine and on ensuring their integration into comprehensive cancer control programs. Our assistance has been primarily facilitated through the procurement of equipment and training the workforce in imaging, diagnosis, nuclear medicine, and radiotherapy.
Thank you very much for that, Nelly. And to May, what tools and expertise can IAEA provide to support countries in ensuring the regulatory frameworks are in place to provide safe and quality radiation therapy?
The first step is to make sure that there are nuclear laws and a legal framework in place to ensure that there could be safe use of this radiation. And what the IAEA does is supports training and capacity building and helps countries develop these laws if they're not available and the legal framework. And then there's a whole slew of capacity building that goes into place to ensure safety in medical uses of radiation. So, for example, we also have capacity building in radiotherapy, nuclear medicine, medical physics, and radiology. So the various specialties related to radiation medicine. We have virtual tumor boards, for example, like AfroNet, which is basically several African countries present their actual cases, pathology, CTs, etc., and we can discuss the management of these cases, etc. It's very helpful in terms of teaching and collaboration across the countries. We also have live webinars, educational publications. We have full curricula online for free. We have guides, textbooks, but even apps that can be used on the phone. The Human Health Campus, which is the vehicle for a lot of these IT-based teaching efforts, has about 5,000 regular users a month.
Many thanks for that. I think to both of you, it'd be interesting to hear a little more about how cancer planners can engage with the IAEA to secure support.
So there are several ways through which cancer planners can engage with the IAEA. The thing to remember is usually we're approached by the country. So, for example, one of them is the country wants to assess the needs. So there are several ways of doing that. One of them is through the IAEA, IARC, WHO impact missions, where a mission goes to assess cancer control. And after that can support the development of a bankable document. But in addition, we have others like specialized country-specific inception missions. And one good example is those that we've been having with the Joint Cervix Cancer Control Interagency Task Force Project. Right now, there are 6 countries and 6 UN agencies, IAEA, WHO, IARC, UNFPA, UNAIDS, UN Women, all of them coming together as a group to address cancer, cervix cancer in this case, from prevention all the way to palliation. We would bring in diagnosis like the nuclear medicine part, PET-CT for staging, etc., or, for example, treatment like radiotherapy and brachytherapy, and palliation from radiation, using radiation. So we have a whole spectrum. We go as a group into the country through this Inception mission, and we meet with the officials. We meet with a large group of people to help determine what the needs are, and then develop a work plan based on that.
Countries request our support in the areas of training, in the areas of procurement of equipment, in the areas of cancer control planning, assessment. I mean, we at PAC receive quite a number of requests per year from member states requesting an assessment of their cancer control capacities at country level to allow ministers of health and other national stakeholders to develop evidence-based policy. We offer expert advisory support also in the area of resource mobilization and health financing, costing of cancer care interventions, all with a view of helping countries to strengthen health systems.
Building on that, Nelly, could you tell us a little more specifically about what role the IAEA PACT scheme can play in accelerating access to radiotherapy?
PACT was established to build strategic partnerships in order to leverage the effectiveness of radiation medicine services in low and middle income countries by integrating them within a comprehensive cancer control approach. And through PACT, the IAEA combines its expertise in radiation medicine with the experience of WHO and other international partners to deliver comprehensive cancer control services where they're most needed. PACT and partners support low and middle income countries to assess their cancer control capabilities and develop sustainable and effective cancer control services. We provide countries with technical assistance, capacity building, and innovative learning methods to expand the cancer workforce. For example, to address the huge shortfall of qualified, trained professionals in healthcare, combined with a lack of financial resources, we have launched a virtual university for cancer control, the VUCCnet, which is a web-based e-learning platform to make educational materials and comprehensive cancer control more easily available for trainees in low and middle income countries. Finally, we help to raise awareness and political commitment to tackle the growing burden of cancer, particularly in low and middle income countries, and advocate for innovative technologies, innovative partnerships, and innovative financing to address the gross inequalities in access to affordable quality cancer care for all.
It would be interesting to hear what you would like to see happen on the side of the private sector in responding to these challenges.
So the private sector is extremely important in support, and there are several areas that can be addressed. But in the case of radiotherapy, improved access can be done through more research and development, for example, and to ensure future availability of equipment that's simpler, easier to use, more affordable, even maybe through a modular design, and also to simplify the process by automation of these complex processes like planning, for example, or QA. You could do remote QA or automated planning, and all these processes would make it much easier for many countries to have a better access and to use radiation therapy in a simpler way. In terms of educational initiatives, they could also do that, and many people are more familiar with that. So provide balanced and affordable information, affordable training, equipment maintenance training, etc.
In my view, this presents an excellent opportunity for the private sector to become greater involved, to invest, to innovate, and to collaborate in such areas as development of new technologies, health service provision, education and training, as well as financing. Similarly, new and innovative financing approaches are required to enable sustainable investments in infrastructure, healthcare facilities, and health workforce. And public-private partnerships offer one way forward towards identifying and implementing new approaches in cancer care. The private sector is a key partner going forward, and one that has to become more involved and more motivated.
Many thanks for that. I think finally, it'd be really interesting to understand what role you'd both like to see civil society playing in improving access to radiotherapy services.
So I think the involvement of civil society is essential as an element of success to address this cancer challenge. Through civil society, you can have a unified, strong voice to encourage change towards greater resources, for example, and planning to address this cancer epidemic. So one of the main things is raising awareness of the cancer challenge. Outreach, promotion of cancer screening programs, for example, that's a very important part, and many elements in civil society are supporting that. And then finally, of course, dissemination of correct and comprehensive information from the right sources to the general public to increase awareness and understanding of the situation and what the issues are, and to help support the public in understanding the cancer challenge and what needs to be done.
In addition to the availability of radiotherapy equipment and infrastructure, other major factors such as political commitment, public awareness and education about the benefits of radiotherapy, reduction of stigma associated with cancer and radiotherapy treatment, transportation, and affordability, amongst others, also need to be adequately addressed to ensure accessibility to radiotherapy services. Now, civil society has an important role to play in all of these areas. Civil society represents the link between national health system, the patients, the health workers, and the community in the widest sense. As it reaches across gender, age, financial, educational, and class boundaries, it can initiate and maintain the much needed momentum to advance national cancer control programs and bring about lasting change to strengthen the health system. Community participation enables culturally appropriate health services and greatly influences their quality and utilization by patients. It also contributes to enhanced awareness of patients about their entitlements, improved knowledge on their health-seeking practices, demands for appropriate care, and fight against stigma and discrimination associated with cancer. Civil society also has the potential to convene key national actors towards a common goal. This is fundamental for effectively promoting comprehensive cancer control and equity in access to care by national health authorities.
Fantastic. Thank you very much. May and Nelly, thank you both very much for taking the time to speak to me today and for sharing not only the role that IAEA has and will continue to play, but also your views on how the cancer community can move forward in collaboration to respond to the GTFRCC call to action and to ultimately improve access to radiotherapy for patients. So thank you very much to you both.